Yeah, ADHD in adults it can differ from person to person, from one gender to another. Can the presentation differ from women than to men? And also it differs, there are multiple cluster of symptoms that can present differently. And I think it's very important to know that when we diagnose ADHD in adults and look at the symptom in adults, we need to be sure that these symptoms are present at least 6 months in adults. And it's important to know that some of those symptoms may have started before age of 12. And symptoms adults can present with different clusters. Maybe inattentive type or inattentive type of symptoms, maybe impulsive type of symptoms, maybe hyperactive type of symptoms. So, and as I said, presentation differ from person to person and from one gender to another. And also the first presentation might be with ADHD symptoms, but also might be with other mental health disorder symptoms. So, for example, inattention usually start by problem to fail close attention to details and sometimes make careless mistakes. For example, like not able to read the instruction properly. If you have certain questions, maybe they answer them, but they don't read the details of the questions. And maybe the answers different things or different part of the questions, right? Maybe sometimes they overlook important details and maybe too much time needed to complete a certain task because of the inattention problems. And also that can affect the relationship with people. Also, they maybe present problem with sustained attention because in order to complete a conversation, it's important to be attentive what other person say or the group of people saying. Sometimes they have problem with sustained attention, especially if they are not interested. And that's why abuse me asks some question like, please, can you repeat again? Oh, I'm sorry, I forgot this. Can you repeat again what you already said? So this is also one of the common presentation. The other one is problem with being easy distractible by external noises because themselves having a lot of busy mind all the time. So they're able to be in homeostasis with their busy mind. When there is any noises around them, sometimes they're not able to pay attention and they focus on the noise rather than focus on the current conversation they are in at the moment. And funny enough, sometimes they keep looking to people because you know that they may lose attention and keep smiling and looking at you. So you look at as if they are listening, but actually they are not. But just they don't want to be caught. And just if you know the person very well, you said, "Oh, are you with me?" I said, "Oh, can you repeat again?" So this kind of things also is very common. So also the misplaced things like keys, pencils, their jacket, eyeglasses. So unless they put coping strategies to put their belonging in certain places, not to miss them. And if you go into the other part, is the organization skills. Maybe they have everything in their mind. They can do a lot of amazing stuff, but its problem is to do that with people. They found problem in put that with people, planning with people. So you always have problem with planning, last minute all the time. And sometimes they fail to meet deadline because everything it's come to the last minute. So this is another issue. And if they want something, you find like you invest huge time in it, do it straight away. If they're not interested, they may postpone things, putting things off. So we call procrastination. This is one of the main things with the client with ADHD. And if they're enthusiastic about something, they start it, take a different level. After they solve the difficult part, come to the regular part, the admin part, they become too bored. And sometimes they leave things half completed at the end. So these are certainly related to the easy forgetfulness or easy distractibility and organization. How about the hyperactivity, impulsivity? We need to bear in mind that hyperactivity in ADHD is not only physical, because sometimes we feel that, oh, ADHD might be hyperactive all the time, jumping all the time. Actually, this is not right. Hyperactivity can be physical, can be mental, and can be verbal hyperactivity. Yes, they might fidget in place. the tapping with the pen and playing with something all the time. Sometimes we get fiddling with their hair or biting nails. Sometimes they playing with other stuff, some stuff in the desk. Yes, this can be done. And some of them maybe like to channel that in socially accepted behavior, like they like sports, going to gym, exercise all the time. Yes, they can do that. But also can be mental hyperactivity, busy mind all the time. And usually try to explain that by if you have a computer and you open like 10 to 20 tabs in front of you, their mind always like this. That's why they always busy mind. And that's why we have busy mind. That's why sometimes they're not able to focus in conversations. And because they have busy mind, they want to express their thoughts. They want to explain what's in their minds. That's why sometimes you find them talkative, oversharing sometimes, because they want to express their thoughts. And sometimes they intervene or they interrupt others for two reasons. Possibly the impulsivity, so if I interrupt other complete people's sentences and impatient, but also part of it, actually, if you don't interrupt at that particular time, they will forget. And then they will forget what they want to say and they will not intervene. That's why sometimes we found them give some inappropriate interruption at certain time. Also, sometimes they found themselves, like, for example, they can't stay in meeting for a long time. They ask for excuses, or can go to the toilet, can we like go to have a cigarette, something like that, in order to able to continue the meeting. But the most important, from inside, they feel restless from inside, especially if they are not interested in what they are doing, right? So this is also part of the hyperactivity related to the ADHD, maybe impatient in certain situations, and but with maturity, people learn how to control this, but definitely they affect themselves, affecting their mental health, and investing huge effort in this coping strategy, and definitely affecting them. So just I want to summarize because I'm sorry for I spoke for a long time in answer this question regarding uh, attention. Yes, they are inattention, but we call it relative inattention. If they are interested, they can pay attention for a good period of time. If they're not interested, they can't pay attention. So that's why I call it relative inattention. Hyperactivity, yes, they're hyperactivity, but not only like the stereotype in our mind, hyperactivity should be physical hyperactivity. No, can be verbal and can be mental hyperactivity. These are the common symptoms of the ADHD in adults. Yes, ADHD assessment in adults, it usually comes after certain steps, because usually if ADHD has been missed to be assessed or diagnosed in child and adolescence, that's why many clients present in adults earlier with other mental health disorders. Sometimes they present with an anxiety, sometimes they present with low mood, some of them to present with relationship problems, some present with drug and alcohol problems. Because we know that ADHD due to dopamine in short supply. So sometimes some of us we want to self-medicate subconsciously. Drug and alcohol, relationship, doing things excessively, like buying stuff, binge watch, binge eat. So this kind of stuff. Right? So the presentation might be with other mental health disorder, and after a while, oh, might be ADHD, and might be with a relationship, as I said, or work-related problems, and then they find, oh, maybe they need to find something else. So how we assess them, either being referred by a counselor that can assess them with other mental health disorder, or come because they have other problems in their lives and they want to discuss the current difficulties in their lives, or currently because of the awareness about people now talk about ADHD, so maybe they identify themselves with some of those. And actually some of them are parents, and they come after one of their children being diagnosed with ADHD. Then after speaking with the doctor or the psychologist or the person who assessed the children, oh, we had these symptoms. Oh, We identify themselves with their children's symptoms, and then the counselor or the psychologist or the whoever assessed them told them, okay, maybe you need to be assessed yourself, right? So they come for assessment, and during assessment, definitely it's very important to listen to them, to take a full history about their presentation, the current difficulties, current challenges at their work, home, leisure time, friends, different things. Also, taking a child history is very important because ADHD, it will never start in adult. It must start in childhood and then it grows with the client. That's why childhood history is very important from the patient himself, but also it's important from an informant, right? Like a person who knows them very well, parent or a brother, sister, or cousin, someone know the person very well since childhood. So clinical assessment is very important, but also we do assessment through a validated questionnaires, because there's certain questionnaires you can give us the details and the information we need in order to be sure that we're not overdiagnosed. Because problem with ADHD, because now ADHD, I think it becomes popular. People talk about ADHD and how it affects their lives, how it affects their relationship, how it affects their work. So in order to avoid overdiagnosis or diagnose people with ADHD, although they don't have the enough symptoms to make the diagnosis, it's important to have a validated assessment, certain questionnaire and diagnostic tools validated in order to be assessed, to be asked to the clients and their loved ones who know them since childhood, in order to get the right information we need. So clinical assessment is very important. Validated questionnaire is very important. So important for the client to pass the threshold on those questionnaires in order to be sure that they have enough symptoms to qualify for the diagnosis. But also, it's very important to see the impact of these symptoms in their lives. Yes, okay, fair enough, they have symptoms quantifying enough to pass a threshold. Right. Does these symptoms affect their lives? That's why it's very important another questionnaire to assess how the ADHD affect different aspects in their lives. If it affects more than one area in their life, we say yes, it affects people's lives, and it can be work, can be retrospectively school, can be socially, can be risk-taking behavior, might be certain skills in their lives. So certain areas need to be taken in consideration. So if you find the patient having symptoms passing thresholds, affect their lives in more than one area, it's very important now to look for some of those symptoms should start before age of 12. That's why it's important to have an interview or information from an informant that know the person very well before the age of 12, and they can confirm all these symptoms and that it happens in the before age of 12. Or sometimes, if sometimes some clients do have the score records that is clearly recorded in different situations that, okay, the measure of hyperactivity, inattention, usually said the student have a very high talents, very high ability, but the outcome is not the same. Need to be more attention, need to be more focused. These kind of things also help us in making a diagnosis. And there is some tools like electronic tools that also can be used to assess the people attention and impulsivity in responding. And there are multiple tools available as well. And we can use it as add-on while assessing the client. Because, especially with ADHD, it's all about subjective, right? Subjective symptoms and cluster of symptoms. You put them together, you explain to the client. It's fine, which is it works, and the validated questionnaire, it works, but again, it's still subjective. Some clients, especially with ADHD, usually they ask question, why? Why are you diagnosed with ADHD? Why I have this? Why I have that? You explain to them. Explain to them from the behavioral perspective, biological perspective, that's fine. But also they may want to see something. There's some electronic tools that you can use in the computer, and it shows graphs at the end about their attention span, their impulsivity. And when you combine your assessment, the assessment questionnaire, explaining them psychoeducation with such electronic tools, and they can use it on the computer, and they see graphs about their inattention and how the inattention fades over time and how they're becoming more impulsive. When you combine all this together, then you'll be able to formulate a diagnosis that can be understood and comprehended by the client, because the most important not only to reach to a diagnosis. It's not only that, this is not the outcome, is to reach to a diagnosis, is to how to help the person. So the person needs to understand the diagnosis, comprehend the diagnosis, to understand how this affect their lives in order to help them to make the right plans to help themselves for the challenges they are currently facing. Yeah. I think the treatment, it's very important, but also I think it's very important when you start talking about treatment is not to focus the treatment toward the medication, because when you talk about treatment, okay, about medication, no, medication is one of the tool of the treatment options, if we may say, treat the adult with ADHD, and not adults with ADHD need to take treatment, by the way, take medication, by the way. Yes, the other options they can be used. The some options like we start with, which is looks simple but is very very important, is a lifestyle modification. Lifestyle is very important in client with ADHD, because basically we believe that client with ADHD is like they have dopamine in short supply. That's why we want to help them to have more dopamine in their brain, and they will help them in their lives. So we advise client lifestyle modification. We understand the client hobbies, and we advise him to be involved regularly and consistently in hobbies like exercise, like going to gym. Some of them like any exercise they like, any hobby they like, maybe drawing, singing, dancing. So exercise or hobby are very important to engage with, especially with other people, because sometimes we do the hobby alone. Sometimes at some point they become demotivated because they have problem to do things continuously and regularly. That's why if dealing with other people, this is our advice, do it with other people you trust and you care. So that's why if they become demotivated, other people or other person might motivate them to back to the hobby or go to them together. So lifestyle modification is one of the things. The second thing is ADHD coach. ADHD coach, I think, is important to help the client to overcome day-to-day difficulties, because ADHD coaches understand the ADHD, understand the impact of the ADHD in areas in life, in work, socially, relationship, studies, in emotions. So that's why it helps client by giving sometimes strategic tips about the day-to-day difficulties. Behavior therapy also is important, because sometimes because of the reaction, the impulsivity, emotional dysregulation may affect the relationship with us. So behavior therapy is also is very important. Certain app we may use, because certain app they can help us with inattention, with organization, how to organize our day, how to schedule our day, how to avoid missing appointments. So certain apps can also be helpful. Now go to the medication. As we believe that ADHD due to dopamine in short supply, especially the frontal part of our brain. That's why the advice is to prescribe medication if it is safe to help clients with the ADHD. Generally, there are two groups of medicine. The first group called stimulant, and second group called non-stimulant. Both of them are very effective, but guideline puts stimulant as first-line treatment. And usually you prescribe stimulant in adults, especially if it's safe. We do some health checks to be sure that the patient is safe to prescribe medication. And we prescribe the medication. And sometimes there is some misunderstanding about medication of ADHD. It's stimulant and it might be addictive. And this is not right, by the way, because actually it might be protective if they prescribe in the right way, with the right dosage, with the right people. And actually, and sometimes people think that if they prescribe medication, they will stay the medication for the rest of their lives. Also, may not the case, because some clients, after a while, they can stop the medication. The medication itself works by help the client with dopamine. And sometimes said, okay, someone is impulsive, is hyperactive. Why you prescribe stimulant? So stimulant will not increase their impulsivity. No, it gives them the dopamine, and dopamine acts like a brake for the impulsivity. break for the hyperactivity. And also it helped to reduce the racing thoughts. So they were able to prioritize their thoughts, and it able to start task and complete the task to the end, because become less distracted by other distractors, so you can continue the task to the end. Less zoning out while speaking to people. These kind of things medication can. And medication of ADHD, it's very effective if this is prescribed to the right person, but we need to be realistic. The medication will not help every person, and we know the medication can help up to 70, almost 70% of clients, right? So still a chance for 20-30% of clients who already have ADHD, but they may not respond to medication, right? But the clients who respond to medication, they respond to medication in different levels, but it is really helpful with many clients in overcoming the day-to-day challenges and help them to overcome their emotional challenges and other stuff as well. So stimulant is first line treatment. We have two stimulants available. We prescribe, start with the first one. If it's effective, we reach to the optimum dose. And if not effective or cause some side effects, we can go to the second one. If it does work, so we reach to the optimum dose. If not, then we go to non-stimulant. These are the three medications available. And usually in adults, we prescribe the modified release one because it's easier to take the medication once a day. And there is some occasions if the modified release one, the long acting or the one, if it doesn't work or cause some side effects, we can use, for example, causing sleeping problems because it stays too long in the client's body, then we may go to the short acting one. Yeah. Actually, this is a very important question because ADHD can affect the relationship in adults in many ways. And it can affect the quality of the relationship between adults, and it can lead to many misunderstandings between adults. So if you talk about the inattention part, which may lead to the communication challenges, because sometimes adults with ADHD, they zone out during a conversation. So when the partner continues speaking, after a while, they found that the other half is not concentrating or attentive with them, and sometimes they feel hurt or as if they misunderstood, or maybe the other partner is not interested in them, which is not the case at all. And that leads to a lot of heating up in the situation. If it's recurring, it might cause problems, right? And sometimes, because problem with inattention, the client themselves, they may not hear certain important part of the topics. And that's why after a while, they said, no, I didn't agree on this. No, but we have discussed it. No, I didn't agree on this. It's never happened. Because they didn't hear it, not because they lied. No, really, they didn't hear it. They didn't comprehend it. They didn't stay in their mind. And the other half, the other person, they may say, "Oh, you think I'm lying as well?" No, it happens. So this disagreement may cause problems. So we understand that sometimes maybe we zone out, are not able to listen. That will help. That's why sometimes after the assessment, the couples, they may possibly become so emotional because now they got some answers for things that happened between them, and they didn't know that was the reason. So inattention and forgetfulness also can cause problem, because sometimes I can forget the important meeting with my partner, or important date with my partner, with my loved one, and cause frustration in my loved one, and then I feel really frustrated as well and guilty because I forget. So these things can affect the quality of the relationship of the partner, and some of them may think they are not heard, not listened, or you're not caring, and the other person feels guilty. But again, it's about the inattention and the easy forgetfulness. The second thing is the impulsivity. Saying something and after a while they regret about it. They didn't mean it. They didn't mean these things to be in the same way, and they become too guilty about saying this. So this is also it's crucial, and sometimes into engage in reckless behavior because they want to chase dopamine, and after all they feel really guilty about this, like speaking to someone or going to certain places, then just because of the adventure, not because of the things itself. That's cause maybe fight between the partners. And also sometimes, especially in the morning, the first 1 or 2 hours, because of the busy mind in the client with ADHD, especially in the morning, to try to calm himself, to try to organize things. What do you do during the day? Sometimes discussion in this first hour or 2 hours in the morning can cause a lot of heating during the day, and sometimes a lot of problems happen in the first 1 or 2 hours. And again, the person having ADHD becomes so guilty because they don't want to be engaged in this, and the other half they may feel that again they are hurted because they were not able to have a proper conversation with the other half. So this understanding also is very important between both. Emotional outburst, because we know that some clients with ADHD, especially with women, they may have problem with controlling their emotion. Sometimes we call emotional dysregulation. They are very sensitive, caring person. They want to help. They want everything to the best. But sometimes because they are too sensitive, and sometimes they lose their temper quickly, and what we this call emotional dysregulation and emotional outburst. And sometimes it causes problems, especially if the people around them they don't know them properly. This also it can affect the quality of the relationship. And also they want everything right, justice. And if things done in the way is not that way, they become very irritable, and also become emotional outburst. But sometimes it's important to regulate their emotions, because sometimes things can be solved in a more calmer way. Disorganization, again, with the client with ADHD, everything in their mind, but they're not organized. So that's why if you are with living with someone, then why it's important to organize things together, and it causes problems, especially with household chores, for example. They become very annoyed with household chores, and then over a while find that they need to have a lot of things need to be done at home. So become really stressed, and you need to do it all the same time, and that causes issues in between themselves and with their partner as well. And sometimes partners think, things are not work out in the house is not is disproportionate between both of us. Procrastination, because sometimes I will do that tomorrow. I will do that tomorrow. I will do that tomorrow. But sometimes the other partner think, you're not interested. No, it's about the procrastination, and sometimes the loved one becomes so stressed because the things are not done on time. But also other thing is misinterpretation. Sometimes because of the sensitivity, the lack of inattention in most of the times, and because of the hyperactive mind, think a lot of stuff, sometimes they misinterpret other half behavior or emotion or words, and take it in different way, and they believe this is the thing, and that causes frictions. And whatever the partner said, no, I didn't mean that, that causes problems. So unless there is very strong understanding and respect and clear conversation between uh, partners in a relationship, that's very important to overcome such heated situations. And after a while, if they understand each other well, especially after the assessment, speaking to the assessor during the assessment, taking the psychoeducation session is very important. Psychoeducation session to understand what is this ADHD, how it affects people's lives, how it affects people's behavior. And sometimes I think 50% of their problems might be solved only after psychoeducation session, without taking any therapy or without any medication. Now we understand. Sometimes we have an expression, our eyes cannot see what our brain doesn't know. If our brain does know the situation, our eyes can see it, and then we'll able to understand it. So I think These are the most important affect the relationship. But also, just I want to say something. ADHD is a gift. People with ADHD are creative, are smart, sensitive, caring by nature, right? So they can help. They can help. They can bring joy to the relationship. They can bring creativity to the relationship, spontaneity to the relationship. But with understanding, self-awareness, patience, put some strategies in place between couples that will help them and their beloved loved ones to live in a healthy, a loving relationship. I think this is a very important question because actually, when you speak to adults with ADHD, even before you speak to them, give them advice, give them the strategies to deal with the ADHD challenges and symptoms, they develop coping strategies all over their lives subconsciously in order to overcome their challenges. Let us start with the simple things, like people with ADHD have problem with eating. Usually, they have unhealthy relationship with food, either binge eat or forget to eat, and some of them may have also present earlier with eating disorders, different eating disorders. So, simple advice regarding please eat three regular meals. Try to avoid snacks because food itself is a source of dopamine. If you're able to regulate the diet, that will help them with dopamine, especially with fruit, vegetables, and these kind of things, and keep them hydrated. Exercise, main source of dopamine, especially if doing with other people to motivate them if they become demotivated at some point. So regular activity may improve, also help them with the dopamine, so it help them with the mood, with their memory and other stuff. Sleeping with an issue with ADHD, usually they have difficulty in getting into sleep because of the busy mind all the time. So help them with the sleep regulation, sleep specific time, wake up at specific time. Usually they drink too much coffees and teas in order to get some dopamine. Is to regulate their coffee, not to drink it later during the day, not to affect the sleep at night. Also, this they can help them to recharge their batteries. This is the word while they are asleep in order to help them next day. But also there is certain things they can use. Certain organization app or calendars that can help them to organize their days, organize the appointment, not to miss the appointments, to remind them so not to miss any dates or important appointment, to double booking, which is very common with ADHD, have to multiple meeting at the same time and causing problems and feel guilty. And that also it's very important. It helping them, especially if they're able to organizing all the calendars in one calendar, come to their phone, for example, so they can see it early in the morning, so they can organize their days. So and also. Especially with people with ADHD, they are easy forgetfulness. So that's why they misplace things in different places. That's why the advice is try to put your day-to-day belongings in certain place at home. For example, your keys, your purse, cards, uh, put them in certain place. For example, beside the front door. So when you go outside, you go take them with you. If you come in, put them in this place. If you put them in other place, you will not you will not find them, and it's causing problems and delay during the appointment. And also, we usually tell them, please try to make the appointment 2 minutes earlier. Usually with ADHD, they have problem in calculating times. So you always come late. Unless they do coping strategies, and some of them come ridiculously early because they don't want to become late, right? So that's why I tell them, okay, if your appointment at 1, please make the appointment, put with yourself, the appointment is 12:45 or 12:50. You'll be there at 1 and maybe more than that, but at least try to avoid being late for appointment as well. But also, one of the important things to ask them is to try to understand yourself better. Go to self-help group, support group. Go to therapy, especially with ADHD coaching, psychoeducation center. Understand yourself, understand your emotion, understand your. If you understand, only by understanding, 50% of the challenges can be overcome. Because now I know, so I will develop my coping strategy to deal with such things. So knowing is very important. So after that, like as I said, these kind of things can help. The apps, the calendar, the healthy lifestyle, support groups, therapy, also are different things can be used by adults with ADHD.
Very well. So now I'll stop the recording.
Thank you.